A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
He put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
And good afternoon, and welcome to the Therapy Hour with Rusty Lozano. I'm your host, Rusty. And you're listening to KFXR Talk Radio 1190, iHeartMedia. And boy, do we have a cool show today. I love people. I love talking to people. I love learning about different avenues of treatments that are out there and how people get into it. And from time to time, new players join the game. New doctors, new therapists, new techniques, fresh approaches. And so it's always good to kind of expose good resources to the community and have some degree of introducing what people do, because there's so many fresh ideas and fresh ways to look at things. So we don't have a particular topic on what we're going to be discussing today, but this is a really neat guy. Dr. Safi from Texas Child Neurology joins us, and he has a really interesting background in computer graphics and engineering, and then into medicine. And we were talking a little bit earlier about, before the show, the effects of video game play on the brain. And I asked him, just out of curiosity, what happens to the brain when you're exposed to video games for a long time? And he had some really interesting things to say. So we're going to start there and kind of see where we go. But I would like to introduce my guest, Dr. Safi. Welcome to the show.
Hey, Rusty. Hey, thanks for having me.
Thanks for being here. I appreciate you taking the time to come join us this morning. And
I am excited to be here.
Yeah.
I'm excited. You got a nice setup here.
Thank you.
A really, really nice place. I really appreciated the tour. I've been sending some patients here, and
thank you.
They've been really greatly appreciative of the services you provide.
I appreciate that. Thank you. It's definitely a different place, and you kind of look at our setup. I want to tap into a little bit of that conversation that you and I had before the show, and it was just a random conversation because I have an arcade here that has these old 80s arcade games and, Spy Hunter, the best ones, Joust,
yeah.
And you have Asteroids. So, and we had talked a little bit about, does video game play have an effect on the brain?
Yeah. And so I loved playing video games growing up, and I used to, spend hours and hours playing those initial video games and the Nintendo 64 and the NES system, Super Mario Brothers, and kind of.
Remember when Nintendo 64 came out and how crazy like the graphics were?
It was Star Fox. That was revolutionary.
that was a fun game.
So that's how I kind of grew up in the Midwest, in Ohio, and so that fascination with computer games led me to computer science, and so I became a computer science fanatic, just getting into programming and then web development. I made a couple video games myself.
Did you really?
Yeah, web.
Oh, that's cool.
Web video games in high school. And
hey, have you seen like the influx of these coding schools popping up all over the Metroplex?
I think it's amazing.
Yeah, so it's just for kids, and I think that you can't go past 18 or something, but it's called coding school, and then it has like a bunch of ones and zeros in their sign, and I guess they teach these kids coding to do exactly what you were talking about, to find an interest in developing and maybe developing new games.
And it's so necessary. I mean, to me, coding or essentially programming languages, it teaches you how to think in different ways and interact with technology in a way that can actually bring benefit to others. And that's really the ultimate goal, is to feel like you're actually helping others or solving problems with technology. And so learning coding is just, or learning programming is just like learning a foreign language. I think every child should get some level of exposure and understanding of how to think like a programmer. And and that fascination with computer science got me into really like education and neuroscience, and the science of learning.
I was having a conversation with my daughter last night, and she's struggling in Spanish, and it was funny because my wife said that the minute I walked in the door, that's when she started crying, and she goes, "You just did that when Dad got home," and I was like, "No," she was probably really upset. But what she was saying is that she wants to get out of the class, and she she spoke to the principal, and the principal said, "Well, everything is full." And I was like, "Well, Hannah, we'll figure something else out. There are other things that maybe we can proposition to her. Maybe you can be a library aide. You can be maybe you can help out around the office, do something." And she goes, "No," she said, "it's full." And it was interesting how she just was so fixated on the answer she got and not thinking around or not thinking beyond like an obstacle. And I'm wondering if maybe like the coding and kids getting into things like this kind of helps them like to think around situations.
Yeah, I mean, that just opens up a whole other thing about the whole industry of education and how, I mean, we're stuck in a backwards technology. I mean, the way the educational system was designed, it was designed for what worked in the early 1900s. And now we're in 2017, going on 2018, and it really hasn't changed much in the past 100 or so years. We really haven't gone beyond that to think about new creative ideas and creative solutions.
Man, that makes so much sense, because if you think about the day, like a day in the 1900s, sun up, sun down, I mean, you have a routine. But now it's sun up, sun down, and you have like several axes of things that you have to do. You have piano lessons, soccer games, and Boy Scout, Girl Scout thing. And so then there's so many multifaceted things that are out there that are kids learning an ability to do this, or are they learning it through our education system, or are they having a hard time?
Yeah, I mean, there's a famous educator, public school, New York City educator that won tons of awards, John Gottman, and he basically described, I don't know if you've heard of him. He basically described.
He has the Gottman Institute, right?
Yeah, and so he basically there's this idea that the way that education is right now, it was designed for the industrial commercial age to create factory workers, and so our students, our kids, are going into this system that's basically pumping them out so they could, at the end of the day, work in some sort of factory-based environment, and that's not going to cut it for the future.
No kidding.
Yeah.
And then like you have, I guess, schools, if you do want an education that has more levels of interest in different things, it's going to cost a lot of money. I mean, it's private education, and some people can do that, and some people don't. That was an interesting tangent, but we're talking about like the video game effect on the brain, and so then we got into coding. But back to that question, and what do you think is happening, like when somebody is exposed to video games for a long period of time?
Yeah, so it's essentially remapping the brain, and we used to think about 10, 20 years ago that the brain doesn't really change. You're just kind of have these neurons that you were born with, and after you get to a certain age, that's it. The brain is as it is, and those neurons slowly degenerate. But now there's this whole science behind neuroplasticity, the way the brain is continuously changing and evolving, and new synapses are growing, and actually new neurons are growing. And they did a lot of studies, but one of the studies we were talking about just before we started was the study on taxi drivers and how these taxi drivers, when they're exposed to a new city, they start driving in that environment, and they're building a map of the city in their brain, and they're very kind of they're able to function without the need of a navigation system, without Google Maps, because they have that map living in their brain of what's happening, where the roads are, and that map correlates to the anatomy of their brain. So they did, these functional MRI studies of the brain, and the brain's actually growing and it's changing in the visual spatial areas. And so when you have these kids that are so invested in video games, role-playing games and these, intensive environments where they're just so into it, I mean, it's remapping the brain.
Remapping the way that the brain actually functions from day to day. New neural pathways, and so then that becomes the norm. And then there's an expectation, well, where's my normal part of the day? And here comes the need for the video games.
Yeah, and they start to interact. It changes the way they interact with the rest of the world.
Do you think that might be kind of what we're seeing happening with this whole technology era, where and we had a discussion. I had a discussion with a doctor last week about interpersonal skills and how kids are spending so much time on electronics that skills like interpersonal interaction, social skills, those things aren't practiced as often now because you can all express it through an emoji.
I mean, and a perfect analogy to that is that our language and our way of communication has changed. We're so into text messaging since the early 2000s. That now it's become common vernacular to say things like LOL in conversation.
Exactly.
I mean, you would have never heard of that,
No.
It's LOL and then, WTF,
Out loud, right?
Yeah.
Like as an actual word, an exclamation? No, is that interjection?
Yeah.
As an interjection. It's really interesting, and it's changing, certainly. Dr. Safi joins us from Texas Child Neurology in Plano, Texas. And today we're going to visit and get to know him and talk a little bit about, his approach with medicine and how he works and contributes to the practice. And they're in Plano, Texas. And we're going to take a quick break, and we'll hear more from Dr. Safi after these messages.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, we're back from the break. If you're just joining us, we have Dr. Safi from Texas Child Neurology in Plano, Texas, and he joins us today talking about the video game elements and what happens in the brain, and also what we're about to get into, social media, and now how this actually, what social media is doing to the brain and our behavior as a whole. So tell us a little bit about your concept, or what you think about what's happening here.
Yeah, I mean, now essentially there's this concept of gamification and technology, and everything that's kind of advanced out there is introducing gamification. And the goal really being to kind of grab your attention and hold on to it, and continuously kind of distract you from what you're doing, so that it can grab you from into a new environment, a new situation.
So now news kind of does this to us, right? I mean,
Absolutely.
they report like several things happening in a row, and then before the break, they'll say, well, we have information about a robbery or something like that. And so they're using, I mean, I guess that uses a lot of fear and a lot of just catchy stories in the first 3 minutes. The first 3 minutes of a news story seems like it's very attention grabbing, right?
Yeah, I mean, the amount of negativity in news is just overwhelming, and it just kind of grabs, people are more interested and attracted to hear about negative things and negative rumors and negative information. But then that starts affecting the way you perceive the rest of the world and just the reality that you function in. I mean, there's so much positivity in the world, but it's just not as attractive from a sensational news standpoint to really grab our attention and keep our attention there.
You know, I've heard of places that have or sites that are positive news websites. Have you heard of this?
Yeah.
And they just report all positive news, and you have to go sniffing around for it, though. It's not going to jump out at you, but yeah, it seems like the negative kind of jumps out a little more, or it's more prominent, right?
Yeah, and those that starts to affect and change our brain processes. I mean, when you trigger a really strong, negative, intense emotion, one, it grabs your attention, but then those memories start to replay in your mind, and you have this classic description of memory. And it's through the Papez circuit, and part of the Papez circuit is the amygdala, and it's the amygdala has a strong responance to negative
amygdala
emotions.
Response, right?
To this,
that's the fear mechanism, stress,
exactly. And so you can kind of date my age, saying I was in high school when 9/11 happened, but that's a very strong fear, concern, worry response. But everybody can remember where they were. If they were alive at that point in time, where they were when the tragedy happened. Right.
That's like a vicarious thing that we were watching happen. Now there's a very real, event in our country, but the fact that so many people were moved by it, it affected us. It's our country, but it didn't happen to them personally per se, but why? Why does that happen?
Yeah. So those images and those memories kind of replay in our mind. And now the way that news is structured and, social news and social media, it's just kind of continuously grabbing our attention towards negativity. And then that negativity keeps replaying in our mind. We keep being reminded of our anxieties, of our fears. And then it affects our daily judgments, our interactions with other people, and just the way we're able to function, when we step outside in the real world.
Yeah, no, I keep thinking vicarious and how maybe people don't want that to happen to them, and that's why it's so fresh on the mind. The same way that you look at something like in the paper and say, or online at Amazon, you're like, I'm going to save my money for that, and you keep thinking about the excitement of having it. It's the same platform essentially, but negative, and we want to avoid things like that.
Yeah,
so
absolutely.
With social media, then there's a lot more risk. I mean, we talked last week about sexting, and I had Dr. Istri in from the Center for Social Success, and so how one mistake can lead to so many repercussions, and kids may not even realize that. Well, when you're courting somebody and you're getting to know somebody as a potential partner or date, that there's a series of steps and time and aging of a relationship that lead up to more affectionate, interaction. But that's kind of being missed these days. Would you think?
Yeah, absolutely. I mean, this just how we build relationships with people, and the borders of interaction and developing boundaries of interaction. I mean, you would never. I had this really interesting conversation with my wife a month or so ago. You would never really accept somebody, coming 1 a.m. In the middle of the night to knock on your door and say, "Hey, let's have a chat about something related to work." If that happened 20 years ago, you'd be like, "What are you doing? This is not the time to be having a conversation with me." But now, if you got a text message at 1 a.m. in the middle of the night and somebody was just like, "Hey, how's it going?" People don't think of anything
like
of it.
I'm sleeping, dude. I can't talk. Yeah.
Yeah, but nobody really feels comfortable saying that.
Mm-hmm.
So, please don't bother me at this time. That sense of a boundary of communication. That there are relationships, but those relationships have certain elements of borders, and that's defined. And so our perception of how we relate to other people is entirely being changed.
But with that being said, it seems like maybe even our community is changing, because if your doorbell rings, period, like people are like, "Oh my God, who is that?" And that's something that in a different era, that was a normal thing to go and like answer the door. It's like, "Oh, hello," and it could be somebody selling Girl Scout cookies, or a Mormon visit or something like that, and somebody that wants to interact with you. But now it's like when the doorbell rings, you're like, who's on my property? Who could that be? It just seems so different now.
Yeah, I mean, the context of the news, and going back to like negative news, a lot of it is just people have these fears that keep playing back in their mind. Oh, what happens if I were to open the door and it'd be somebody that I'm unfamiliar with and they were to do something harmful to me? I mean, those stories we hear about in the news, but contextually speaking, I mean, how prevalent are those?
Right.
And it's just the fear is way more.
And exactly, because let's talk about anxiety for a minute. The fear of something that is the absence of a stimulus, right? And in your mind, when somebody has all these reservations and fears, it's grand. It's a big thing. There are major elements that keep them from doing certain things because in their mind, it's just so terrible. It's just terrifying. I could never do that. I'll give you an example. My daughter, when we first rode the Titan at Six Flags, and we were watching it go up, and people's heads would get like tiny BB size, and she's like, "Oh, I'm not going on that." I'm like, "Come on, let's just go. Let's just try it." She goes, "No, I'm not going to do it." So in her mind, it was like, "Well, what's going to happen? What's the worst thing that can happen?" She's like, "I'm going to fall out or something like that," And but then we actually get on, and I keep moving. I'm not leaving the line. She keeps like trying to stand off, and I'm like, "Just try it. You'll love it." And so at the end of the roller coaster ride, she said she wanted to do it again, and then we ended up riding it 7 times that night.
Oh, wow.
But that's the way she was. We used to get the flash pass at Six Flags, and man, I was like walking sometimes like a squished roach. But we called her mom that night and said, "Oh, we're at Six Flags and we're looking at the Titan." And she goes, "Oh no, I never want her to ride that." It's the first thing that she said. And I was like, "Well, we rode it 7 times." So it's that same imagery, right, that keeps people from taking chances, and they respond to that. And is there a disconnect between actual events and actual activity versus concepts and ideations in the mind? And that could be what's maybe keeping people from our natural way of interacting that we've always done before, and texting and communication over social media is so less threatening.
Yeah, I mean, you could say that a lot of those perceptions of reality and they were there to serve us and for the benefit of ourselves and our families and society. But now the world is changing so rapidly and so fast, so it's hard to say, how do we perceive our interactions, and are they really benefiting us? Are they serving us more than harming us?
I think they're harming us. I mean, I think that what we need to do is get back to, teaching our kids the basics of introduction and not expose our kids to electronics. And I remember the day that we gave our kids electronics. They were given leapfrogs for Christmas, and they're dorky. It wasn't the cool thing. And somebody had said, "Well, they're Nintendo DSs." And so then they're walking around saying, "I got a DS. I have a DS." And it was this big clunky, leapfrog machine. And I was like, "That's not a DS, man. I'll show you what a DS is." And I made the mistake. And I got them a Nintendo DS. And that was the point that I regret, because I would have loved to have halted exposing them to electronics to have them work on these other skills, friendships and social interaction and conversation skills. You know what I mean?
Yeah, I think it's just, a lot of kids, they don't realize what electronics, what technology really is. When you get a phone, what is the phone really doing? I mean, it's facilitating communication. And if you stick with the same standards of communication, that same, treat people like you want to be treated, or how they want to be treated, and, use essential basic mannerisms. You be polite, you be nice, you be kind, you say please, you say thank you. And if you recognize that a phone, a text messaging system, online, being on Facebook, being on Snapchat, Instagram, all of these are just means of communication. If you treat people as if they were just right in front of you with your grandmother in the room, then you can start to realize that, well, this is the same standard that I use, the moral standard of communication that I use in an in-person environment, I'm going to use in the online environment.
I like that. Yeah. I like that. That kind of gives you a filter. If you wouldn't say or do those things with a family member in the room and saying it out loud, then you wouldn't want to do it on text, even if your friends dare you. You know, it's just not a very cool thing. So peer pressure changes too, right?
Yeah.
And there's, I think, our little girls. Do you have kids?
I do. I have 2 kids. Yeah, 2 sons.
2 sons. Oh, you have the boy element at home.
Yeah.
So I have 3 girls and a little boy, and I worry about how my daughters are going to be impacted, or how they're going to handle like the era where there's a lot of pressure on kids on girls especially, on body image, on clothing, on on affection, because in our society it seems like there's a lot of they're being sexualized. We're going to take a quick break. We'll be right back after these messages, and we'll hear more from Dr. Safi.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hello, welcome back to the show. If you're just joining us, we have Dr. Safi from the Texas Child Neurology Clinic in Plano, Texas. Really neat guest, informative, and we're going to talk a little bit about like he is a person, because you have several degrees. You have a computer engineering background, and we talk a little bit about that. But I'd like to maybe talk about what made the switch. What made you want to get into medicine? Because you actually have tell me your degrees in computer engineering.
So I've always been a fan of, I saw the way my dad worked, and I've always been a fan of overlapping the things that I do with other things that I'm fascinated with. So I was super fascinated with computer science and programming, and then I saw a lot of interest, and there was a lot of people kind of advising me to look at medicine as a potential career option. And so
and this is after you're already established in the computer engineering stuff.
Yeah, so I had already throughout high school, towards the end of high school, I had my first job as a programmer, and I actually got into programming and education and consulting. So I was doing that in my early years of undergrad. And I went to undergrad in the East Coast, and it's a very busy, fast-paced environment. And I started doing research in both computer science applications to biomedicine and bioinformatics, computational biology. So these are like surgical robotics. So these are all like a variety of different projects that I got into. And so ultimately I ended up dual majoring in biomedical engineering and computer science. And that was a degree from Johns Hopkins.
Wow.
So then I started working in consulting more formally and continued my passion for education. And throughout that whole process, I was just kind of drawn to medical problems and medical devices and developing solutions for the healthcare industry. And, as I advanced myself, I started to ask myself the question, what do I find most fulfilling? Am I going to wake up 10 years from now and feel like I've made a difference, that I'm actually, my profession has meaning? And I slowly started to realize that, I felt I was doing the things that I was good at the time, but it was hard for me to see myself waking up every morning, 10, 15, 20 years down the line and really feeling like I was making a difference. And so throughout my process of getting into, medical applications, I started shadowing different physicians. And that was really the first time that I said, whoa, this is actually something that I can make myself get into.
Wow.
And the thing about medicine is, it's no small endeavor. You really have to put in a huge time investment to get into it.
Right. And here you are, you're already established in your computer science career, and you're double majoring, you have bioengineering background, biomedical engineering, and so now you're about to make a big shift.
Yeah.
And so tell us the story on that. Were you married at the time, or were you?
I was not married.
I was going to say that's going to be that's quite a quite a ricochet right off the wall.
Yeah.
So.
But I had that biomedical background, and I was able to use that and leverage it to kind of pivot to more directly into medicine. And I held on to my technology, skill set as well, and education. And so, I do consider myself privileged in that sense to be given the resources, the family support from my parents to be able to make that transition. That was back in 2000, end of 2005, 2006.
Wow.
Yeah. And so, if you think about it, I'm just now finished my training early this year. So it's a 10 plus year commitment that I just went straight in, 80 plus, sometimes 100 hours a week with the clinical aspect plus the learning that goes behind it. And so, I love it.
Yeah.
I love it.
Wow.
Yeah.
So you saw there was something there that inspired you to want to do more. And man, as in my industry with electronic assisted therapies, I mean, you're a diamond. I mean, you have the background to make a massive contribution, because as the era of electronics gets more and more advanced, and we're talking about now devices that, like your iPhone, it's essentially just a computer, right? And they get smaller and smaller. They even have computers that are even nanotechnology computers that can do some amazing things. That combination of the engineering and the medical, the computer engineering and the medical aspect could be really, really priceless in making some advancements in the field of medicine.
Yeah, absolutely. Absolutely. I mean, even now, like yesterday, I was having a conversation with my father-in-law about blockchain technology. And that in combination with AI, and 10 years from now, it's going to be an entirely different world that we live in for the better.
You see that you see AI having a big, a massive run here.
Absolutely.
And it seems like it's everywhere now.
Yeah.
Did you see the one Russian? It was a Russian. They have these new robotics, this artificial intelligence, but they're robots that they're going to actually send up into space and actually land on planets, and they kind of look like these Star Wars androids. Really amazing what they're able to do, and they're just worker robots, and it's really moving, isn't it?
Oh wow!
It's things are really, really changing, but I don't know how comfortable I feel just yet with the idea, and I don't know if that's maybe because of the conversation we're having earlier that we have all these fears. And Hollywood kind of puts ideas in our mind. You hear about the one robot that actually now has she's a residence to Saudi Arabia. They give her citizenship.
Really? Oh, okay.
Yeah, they give her citizenship to Saudi Arabia, and she's her own. She's her own individual. First artificial intelligent robot to actually speak her mind.
Wow.
But then there was that Zuckerberg research where they had these two AIs, and they created their own language, and that was kind of different.
Interesting.
Yeah, that was.
There's a lot going on.
There's something. I mean, it's really moving fast.
Yeah, I think. But going back to what we said before, the things that we have to hold on to is what makes us human, and that communication aspect, and just recognizing those same principles and values that we operate and function by, because otherwise the technology will get out of hand. But right. I mean, we're the ones. Technology is a tool. We're the ones that use it for the benefit, and that's. And when I got into medicine, I saw I had this big skill set for technology, but ultimately what I wanted to do was really just help people. I wanted to just have that very personal interaction with people, and I felt like I couldn't do it as well getting into technology. I felt very detached from that human interaction.
It was like that human element that was just missing. It's very mechanistic.
Just being able to meet face to face, and then just help somebody in a meaningful way. And that could just be through education.
Right.
Or facilitating them to meet other people and getting the help that they need, or through medication, through therapies, through referring them to you.
Yes, thanks. And I have a question about something. Do you think that technology and the way things have changed are now, because you have insight into the technology arena and like what things are happening and how it's having an effect on the brain, do you think that there's more symptoms we're seeing more symptoms and more issues now than we were maybe 10 years ago because of technology?
I think technology is basically a way to magnify what we see. So everything that we've seen before, we can see it at a greater level of magnitude. So if there was anxiety before and there were fears before, now technology, social media, the whole news industry can magnify those fears, and not just in the number of people that get exposed to those fears and anxieties, but also on the level and the severity of the fear and anxiety and how it affects people. And the same token, if you're here to make an impact and bring benefit to the world, technology can help you magnify that, and it's up to people
That's
like
great.
us to really make a difference. And that's what I saw, that I could, as a doctor, I can help people one-on-one, but then I can use technology to magnify the impact and the benefit that I bring to others.
That's a great balanced approach. You're seeing both sides, and it's equally matched. I have this one chapter in our training because we incorporate cognitive behavioral therapy into things that we do. And there are 3 platforms. This is the way I outline this. There are 3 platforms of perception. You have to think about the brain. It's never been outside of this cranium. And if you ever peek through a hole in a fence, and like you look to the other side, that's all your eyes are. Your eyes are sensors. And then from the top of your head to your toes, your brain has sensors throughout the entire body. And it can tell you what's going on. It knows what's going on in every part of the body in any given moment at once. And so 3 platforms of perception. There is the perception and the visuals that you see with the sensors, your eyes, which can be clumsy because you can't see beyond your ears. And also, how important are the eyes? Because without corrective surgery, some of us wouldn't even be able to leave the house. Kind of walk around like this. So what do? You start touching things with your hands, and you're processing things through the sensors to see what's going on. The brain registers that as proximal distals. And then you have the perception that's more internal. And your brain can't tell a difference between what it sees with the mind and what it sees with the eyes. So you have external processing, you have internal processing, and then you have a blended response. Blended means if you, like here I'm looking at this, the here and now actual. On the other side of the door, if we heard a roar or a bang on the door, we'd speculate what that is. And in our mind, it sounded like there's a dog out there. And then we are visualizing or projecting something on the immediate, actual platform of perception. And so that's a blended response. And we try to differentiate those. And one of the things that I spend a good amount of time trying to educate, parents, because our co-pilot program, we treat the parent and the child, is we try to really teach them the differences between what you're perceiving and what you're reacting, prejudgment in the mind, and then what you're seeing with the eyes. And there's a huge difference there between how we're actually understanding our immediate experiences based on what we're looking at. Now, if this is an actual environment, we're in this room and it's in the studio, but then you're thinking that you have an exam or something after this, then you're thinking about, how could that be creating so much of an issue if it's not even in front of you? Yeah. It's very interesting.
From a neuroanatomy perspective, what you're describing is essentially kind of unimodal sensation, where you have this just a simple sensory input, like you're seeing certain colors or objects, that's unimodal, or you're feeling certain things, certain textures. But then there's multimodal, is kind of putting those together. But beyond that, there's kind of this inner consciousness that we really have a poor understanding of. But I think that's really the images and the thought processes that are playing in our mind, beyond just what we're primarily sensing right in front of us.
And I think that that's something that we can really spend more time trying to learn about and teach, because it's a very important element when it comes to differentiating a perceived fear of not wanting to take chances. I call it pain behavior. And that's, I don't want to go because it's going to it's going to give me a headache, or I don't want to go because I have a headache. And which one's the real element? We're going to take a quick break. When we come back, we'll hear more from Dr. Safi.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hello. Welcome back to the show. This is our fourth segment. If you're just joining us, we have Dr. Safi from Texas Child Neurology in Plano, Texas. He joins us.
Great to be here.
Yeah, thanks. And this has been a really, really neat show. I've learned a lot, and you're really interesting. I mean, you have a lot going on, and I would like to spend some time maybe talking about what you're doing over at the center, and then maybe some of the other things you have in mind that you're researching.
Yeah. So there are two main types of people that I love helping. One are my patients, as I'm a child neurologist, and the other are just the students that I kind of hope to inspire to do the kind of medical work that I do. So I'm a child neurologist, and I basically help take care of children. It can be from the moment they're conceived, when they get that first ultrasound, and there might be some neurological concern, to after they're born, to as they slowly develop and become adult in size, and then hopefully adult in maturity too. So, from that.
So from like birth to adult.
Birth to adult, yeah, and so even some adult aged individuals.
Yeah, because pediatrics goes to 18.
18, and so we might extend that to 21, or we might have some severe autistic kids that are very developmentally delayed, and they might be adult in size. But there's kind of the tragedy of today's healthcare system is there aren't enough adult providers that know how to manage and care for these adult-sized, what I would say still kind of kids in a lot of senses.
Yes.
I mean, they are very high need. They require a lot of attention, a lot of medical care, and it might be from certain genetic conditions. It might be from unknown etiology of autism, and so I help those children and their families, manage their medical issues, and I take a kind of a very, what I like to say, integrative approach. So,
what does that entail? Integrative approach.
So, for kids with ADHD, for autism, for seizures, concussions, headache, I look at what's going on with their biology. Mm-hmm. I say what are their laboratory tests looking like? What does their diet entail? And I also look at what does their day-to-day schedule look like? Their environment.
Wow, that's pretty involved.
Very comprehensive. So the family history, the family environment, the social environment, the foods that they're eating, their sleep-wake cycles, and how all of that can play in. And so really when we have, a child might come to me for what we might think is relatively straightforward as ADHD, or it's a spectrum of symptoms of hyperactivity, distractibility, impulsivity. And so, one might think, you just go get this diagnosis and you get prescribed a stimulant medicine.
Right.
That's,
you leave there with a prescription.
Federally controlled. And, I don't take that approach. I look at what's going on. Is this really kind of a symptom of an underlying condition? And are there other factors that are at play? A child may have some significant sleep issues. And because of the poor quality of sleep, they might be having good quantity of sleep, but the quality of sleep might be poor. And that manifests as
an attentional issue.
Yeah,
that's interesting. Yeah, that's because there are several things that can look like an attention issue. A is true ADHD, then you have sensory processing or sensory integration elements, maybe auditory processing, and even depression can kind of seem a little attentional as well. And so what you're saying is that you use a lot of forensics and like really trying to understand, get a full comprehensive.
Yeah, I think one of the most important aspects of being a good neurologist or a good doctor in general is to be a skilled detective.
Yes.
And you have to have great rapport with your patients and the families so they understand that you're there to kind of help them and yourself to understand what is going on, and that takes a lot of detective work.
It does, and trust, and I think that the rapport part of it is really, really important. I mean, do you find yourself having to maybe even say something to the parents about their behaviors and the things that, if a child confides in you, well, my mom or dad, they scream, or me or whatever. Do you find yourself having to also make that hard conversation with them?
It oftentimes comes to that, but really the way I think of it is, if a parent brings their child for help, we're all there for the child's best interest. And so I always see it as a conversation, that everybody's trying to help the child get better, get through their challenges, get through their suffering, and make progress, really, get the help that they need. And so it takes everybody to kind of collaborate and be on the same page. And
yeah,
that
for sure.
That can be some very difficult discussions.
It can be, for sure, because that means that if you're really getting to the crux of things, then things have to be addressed. I find myself doing that, and I was telling you about our approach where we have both the parent and the child in the room, and it makes it really easy to maybe to treat, if there's a parent element, because I don't want to make the generalized statement that it's the apple in the tree, but sometimes it is. And I've had parents that come in, and I'll ask them when we do our phone intakes, is there something that you would like to work on? And very rarely have I had a parent say, no, I'm just gonna go. I mean, they will actually start saying, I would like to work on my anxiety as well. And so it kind of gives them a reason to work, and it makes it a little safer. I think that no parent wants to look at anything that they are doing to maybe contributing to a symptom, but maybe it is, maybe it isn't. But when you address both the parent and the child in treatment, then I think that you're casting a pretty wide net, and there's some continuum. So it's not like you're just coming here and fix my kid, and I'll have a seat out in the waiting room.
Yeah.
It's, let me show you this method and some things that maybe can work
I really
on.
feel like everybody has to be invested in that child getting better. And that takes, if it's an investment, on the parent's part, it takes a level of emotional investment, a time investment, and they actually have to make a change in their behavior and their schedule. Whether it's driving them to therapies and seeing how they can learn the therapies themselves, or even just something a little bit more straightforward, even issues with medication compliance, like a family member or their guardian or parent has to make sure that their child is compliant with their therapeutic regimen. So oftentimes I ask families, keep a record of the headaches that you have, or keep a record of how your child's focus or attention is. Now, the child's not going to be able to do that themselves. They need regular reminders. They need their family members. They need their teachers.
Yes.
Everybody kind of caring for the child and fully invested in it.
Right. And advocate, that for the families is, working with the teachers, getting feedback, so you have a good perspective. And sometimes it's interesting that you actually learn things about that child that, because they can present like they're great. And in fact, I have one case here that, I have a father and daughter that come together and they work, and speaking to the mom. Well, when they come here, they present great, but then I speak to the mom. I was like, well, did you ask her about this? I mean, maybe you should ask her about this. And when I do, it's a whole nother issue. And that's why I think it's important to kind of have that involvement, is so that we're making sure that we're addressing what needs to be addressed.
Yeah, definitely.
Super important. So what else do you have going on? You're at Texas Child Neurology. You see patients. You involved in any other projects?
Yeah. So the other main thing is that I just love mentoring students. And so I've been through a variety of different careers, and just facilitating other students to kind of come and work with me and see what it's like to be a neurologist, see what it's like to.
Oh, that's cool.
Yeah. I mean, I helped set up a workshop in the past, about 12 months ago. It was the first of its kind. Basically, it was the intersection of technology, education, mentoring, and medicine. And this is a workshop for kids with disabilities, and exposing them to learning skill sets and technology that could just radically change their career track. So just imagine a child with a severe neuromuscular disability. They're wheelchair bound, and they're looking to kind of make something of their life, and just being shut down because of their disability.
Right.
Somebody says, oh, well, you can't do this, you can't do this, you can't do this. But now if you learn, we were talking about programming, if you learn programming languages on on your phone, or if you learn design skills, or even video making skills or blogging, those are actually marketable, valuable skills that you can use to, create an income and like do something with your life.
And even like have an in your garage kind of project, because, so many of these platforms are so mobile that, you can start something on your own laptop and your own phone.
Absolutely.
What you're saying,
Absolutely.
It's like on an iPad, So it really.
So I love doing stuff like that. It just really motivates me and just energizes me to really.
You've been doing that here in Plano?
Yeah.
Really? So do you have a website or something that people can defer to you and find them, maybe like where you're doing some of these projects at?
Yeah. I mean, just check me out, texaschildneurology.com.
Okay.
And then I'm the newest doctor there, so you could just send an email to us, and they'll get it to me.
Nice.
I got my own Facebook page, facebook.com. It's Ask Dr Safi, Ask Dr Safi. So I like to just answer people's questions, specifically on career mentoring, but I have some videos to help my patients understand their disease process, that just understand the diagnosis, understand the different therapies, and
that's Ask Dr S.A.
F.I.
F.I. And that's on Facebook.
Yeah. Ask DoctorSafi.
That's cool. So it's like a doc corner, like get to know the doc, and you get a lot of inquiries about, should I bring my child in, and this is what's going on.
I mean, right now it's just something new it's a new initiative, but it's an effort to kind of put myself out there and say there's a lot of help that people can get, and it's a resource for my patients and the different people that I help.
That's great. I think that's invaluable, because you're making yourself available, and that's kind of like what you're saying with technology. That's one of the more benevolent aspects of it, is that now help and resources are within a click away.
Yeah.
And we made the comment earlier that with so much going on, I mean, there's so much information out there. There's bound to be misinformation. So where do you find the right good? How do you find the right avenues of info, and how do you access that?
It's so important, because so many patients, if you just imagine being in a situation where your child, God forbid, had some medical concern, they were to have a seizure or something to that effect, and you're going to get on Google, and you're going to Google the heck out of that condition or those symptoms.
Right.
And you're going to be really, really worried and spend hours and hours doing that. So why not just find the right resource, get to the right people earlier on?
I like that, Dr. Safi. I really appreciate you joining us today, and thank you so much. This has been so informative. And it's Dr. Safi. Ask Dr. Safi on Facebook.
Yes.
And I'd really love to have you back sometime. This has been a great show, and thanks so much for spending the hour with us.
Thanks for having me.
All right, have a good one.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hello, and you are now joining the after show. And this is where we kind of go into more just easy discussion. There are no time restraints. So this is more of a podcast mode where we just have open discussion, so no pressure on anything. I thought that was a really good show. And what we do, you can't see behind the scenes, but we always kind of stage, at the break where we're going to go with the next segment. And with a short amount of time, we do have to kind of make sure that we get the pertinent information in, which is all great. I mean, it's good discussion. But here, there's a little bit more flexibility, and we can just kind of have a conversation openly about projects and maybe a little bit more of an extension on ideas that we can go into. I personally would like to, talk to you a little bit more about your biomedical background.
Yeah, definitely.
Because it's fascinating to me, because that's essentially what my field is. We look at the peripheral nervous system, and with that, how the fight or flight or the sympathetic network affects people.
Mm-hmm.
Here's the concept. The Pavlovian dogs.
Right.
Conditioned responses. Well, when you see a like let's say a monkey run into this room and it started to kind of destroy things. That's an actual stimulus. You see it with your eyes. Your brain goes into this sympathetic mode, releases neurocorticotropins into the bloodstream, adrenaline for the adrenal medulla, and then your body goes into this reaction. Muscles tense up, breathing gets rapid, skin begins to sweat, blood pulls back from the extremities, gastric juices increases in the stomach, pupils dilate, heart rate increases. And for the moment that you're engaging the stress, this physical element really takes over. And then when let's say we chased the monkey away or we caught it, the response shuts down. Parasympathetic elements start to kind of increase. And then you can overcome like the stress, right? So what happens in the theory here is that when we see symptomatic individuals, we're looking at a complement to the medication approach. It's not an alternative to, and this is one thing I really try to emphasize to docs, that we're not like a last minute or last, I guess, option, well, medications don't work or, that's kind of how they've typically looked at this approach. We complement. So there's a point that medications go and then symptoms might kind of go a little bit above. And it's not about getting the kids off the medications, but is the stress and anxiety, that the sympathetic element that's been reactive for such a long period of time, then created a conditioned response, so they're consistently in a sympathetic element. And so then that can kind of seem to bring symptoms over the top. And that's where we come in and teach, stress management. We teach relaxation skills to kind of increase more parasympathetic dominance. And then there comes a point that those levels come back down, and then the medications kind of take effect, and it's kind of more of a balance. And they learn coping skills.
Yeah, I think, and that's so important to understand that it's not a one or the other. I think of it as a symbiotic relationship. And I even say like education. Education to me is talking about why the patient has those symptoms and what's happening. What are the processes to kind of get to that level of sympathetic response? That's educating the patient and
right.
understanding them. That's the first line medication.
Yeah, you think?
That's how I think about it. If they don't have a good understanding of why they're experiencing those symptoms, then it doesn't matter what medication, what pill that you give them. They really have to have a good understanding of their diagnosis and how that pill might affect them.
Right.
And it's well-known science that pills by themselves, if you're talking about anxiety disorders, pills by themselves are not as effective as the combination of medical therapies
right.
with things like biofeedback,
like
counseling.
So biofeedback actually, it has a really interesting history. It started back when they were actually doing a lot of animal studies, and this one individual, Neil Miller, I researched him extensively, but he taught rats how to turn their ears red. He'd place an electrode into the pleasure center of the brain and give them a little zap of stimulation, and then the little rat would kind of like try to perform tricks in order to get that reward. And then when he first introduced his research to the medical community, they laughed at him. He's a medical doctor. They were like, oh, well, his ears are red because, he's in that sympathetic, those are sympathetic traits. And, he was maybe running the course of the maze. And he's like, no, this is actually something that he's done on his own. And so he wanted to prove it. So he carterized the rats, put them on little tiny ventilators, and, again, sensor on the pleasure center of the brain. And then what would happen is that they taught the rats to kind of urinate on command, defecate, and also turn their ears red. And so when he presented that was very monumental. Harvard University then had the first school of psychophysiology in 1972. If you want to know more about biofeedback, research Harvard and biofeedback, and it's prevalent in their medical school. But the whole idea is that you're right, educating somebody going to how these processes affect the body. And then, giving them a point of reference, which is what we try to do, is show them when you're in this state, this is what it's like. When you're not, this is what it's like. So that whole first line of a defense, understanding that the physiological processes of what's going on, can, in my perspective, it seems really essential.
And that kind of brings up this issue, this huge misconception that people have when they talk about anxiety disorders, when they talk about a lot of these psychological symptoms, even things like tics or OCD.
Yeah.
And the problem with nowadays is it has this perception, and it's a huge misconception. It's all in your head. But there's a strong biology and neurophysiology and neurochemical response and synaptic changes behind it. And there's a way to kind of change that over time using the types of training that you're recommending, using sometimes medications, pills.
Right. Oh, no, medications for sure.
And so it really, and I look at other things too. I look at what's going on with their diet. I look at what's going on with their blood system, their nutritional, their vitamin factors.
Do you think that people who really spend time like looking up nutritional value, buying organic, is that really effective? Is that really doing something, or is all the foods that you read about GMOs and things like that, I mean, and very low nutritional value in our food these days? Can diet really make an effect on?
It can make a huge effect. It can make a really huge effect. Now, I don't want to speak specifically in regards to GMOs or organic, but diet can absolutely make a huge effect on how people's cognition, their emotional response to things can factor. And I've been on something like a modified ketogenic diet. And
oh, really?
Yeah. And I've tried. And ketogenic diet, for just give you a very straight. It's a very difficult diet to follow. Ketogenic diet is a challenging diet. Now, some people, they've kind of mastered it. It's become easy for them. But it can be considered a treatment for epilepsy even.
Really?
Yeah, convulsive seizures. People are using this diet to treat convulsive seizures.
And the whole idea is that you kind of stay in that state of keto, and it takes a while to kind of get there.
Yes, it does.
Right?
Yes.
And what is that? Can you define that for us? What is it?
So, the brain can use two energy sources. One is glucose.
Okay.
And the other one is ketones. And it's really fascinating because this is a unique way that God kind of made us.
Mm-hmm.
That if you eat a candy bar, that's glucose, that's sugar, that's going straight in your bloodstream, and your brain can process it, and you might actually feel a high. And children, you'll notice that they become very hyper.
That's when you see the snap, crackle, pop coming out of their ears.
And so then, in response, the body releases insulin. Insulin is released from the pancreas. And that kind of shoves the glucose into the cells, specifically the liver and the muscle cells. And now, so the serum glucose level drops. And so if you've ever felt a sugar crash or you've ever gotten the itis
right.
after eating a very heavy meal, that's your glucose levels crashing. Now, if you're living in a state of ketosis, and a lot of people who practice fasting or intermittent fasting, they have experienced something similar, where your body's, instead of using glucose, it's burning fat, and then the ketones are living in your bloodstream, and your brain can start using ketones. And so what happens is your energy levels, meaning how your brain is processing energy, it's much more steady state. And you feel a lot of this, less of this kind of dysregulation of up and down, up and down, up and down. And so moods can be much more regulated, and people can be more clear in their thinking process. And so there's a lot of research that's well backed.
It seems like, yeah, my neighbors are doing it, and they yelled at their kid for coming over and having pizza at our house. She's like, we got in trouble. She goes, no, she cannot have those foods. And I'm like, oh, we had no idea, but because it takes a while to get into that state.
Right.
But some of those keywords that you were saying earlier with glucose and
ketones.
Yeah. Well, I mean, with the what's the word I was thinking about? There's glucose, and you said something is released from the insulin.
Yeah.
Those seem to be kind of the diabetic kind of key terms that you hear a lot about.
Definitely. Yeah.
And so a lot of sugars in our food. And I mean, is that one of the reasons that we see so much of an epidemic?
So this chronic, high release of insulin from your pancreas will burn your pancreas out. And what happens if there's so much insulin just kind of sitting around in your bloodstream from eating these very, very heavy carb meals, what will happen is your cells, they become resistant to insulin. So that's what diabetes is. It's insulin resistance syndrome.
I see.
And so it has not only effect on on the day-to-day, your mood, the way your brain is processing it, but then the other organs start getting affected.
And then that's when the pancreas burns out, that's when that type 2 comes in, and you have to give yourself
when
an
the pancreas
injection.
burns out, then and you become insulin-dependent diabetes.
So then you need to carry around a little your shots with you.
Yes.
And watch your diet very closely, and probably be in a ketosis. Probably do a ketosis diet. I mean, by default.
Yeah, I mean, no, it wouldn't be default. People still have glucose running around. It takes a lot of effort to do a ketogenic diet, but that is something that I've been investigating lately. And there's some early stages of research looking at ketogenic diet and its utility in diabetes, and potentially, there's some controversy over the word or the usage of the word reversing,
right?
Potentially reversing the insulin sensitivity, reversing the insulin resistance to get to sensitivity.
Interesting. How long can somebody be in that diabetic state, pre-diabetic state, before they actually become full-fledged diabetic?
Yeah, I mean, if you're in a pre-diabetic state, you can pretty much stay there for. It's like you're living on the edge. Because when you're a pre-diabetic, it's almost like you've burned through half of your pancreatic islet cells, the ones that release insulin. And so you're functioning at a reduced capacity. And so you're very close to kind of tipping over the edge.
And is that something that the pancreas can regenerate, or is it just that's finite?
Yeah, it's pretty finite
right
now. But you can, if you're living on that edge, you can retrain the rest of the cells in your body to become more sensitive.
So then they need less of it.
Yeah.
That's fascinating. I never really knew. I never knew how that worked. But
yeah, and it really ties in strongly to neuroscience and neurocognition and learning issues. Yeah.
Have you ever seen that movie, What the Bleep Do We Know?
I haven't, no.
Oh man, it is so cool. It's a bunch. It's all neuroscience, but it's these brainiacs. They're nano. What is it? They look at nanotechnology, and that's not even like it's a type of chemistry, but they look at the world from this finite state. Mm-hmm. It's I'll think of it here in a minute, but they talk about how perceptions actually, how we have perceptions, and there's concepts in there like there are a million different ways that your day can end up, but something as simple as lifting up a cup changes the course of action, and that's what continues to kind of change, your day. And you could potentially end up over here. You can potentially end up over here, but it all depends on like what you do that's going to determine those. And they all exist all at once. And it's fascinating. And these are professors from really, really astute universities, kind of talking about the whole concept of perception and how the body and the brain perceives things, and how they introduce the concept of emotional addiction, and how a person may subconsciously make either fall into the victim role or fall into the seeker, and they're all these, and they have these peptides that are looking at the hypothalamus that releases these peptides, and what a person what their mode is.
Yeah, I mean, it's almost like there's this idea of this butterfly effect, and I don't know if you've heard of it, but basically it's like
saw the movie.
Yeah, a butterfly flaps its wing on the other side of the world and it causes tsunamis and across the world. But basically, as you're talking about emotional addiction, the things that the day-to-day things that we're doing can have profound implications on our life. So here's a great question to ask oneself. What do you do if you have 10 seconds or a minute free? Immediately, now the answer that most people would have that are probably listening to this podcast is, well, I'll check my phone. And they're looking for that distraction. They're so in tune that, well, I have a moment free, so let me look at that notification from Facebook or my messages or something else that's going on. They're seeking out that distraction. So we've kind of trained our brains to say, if we have a moment free, instead of kind of reflecting on our day, instead of taking a breather, walking, we just say, well, I could just distract myself more.
Make a move on Words with Friends or something.
Empty consumption. I mean, people are just consuming news, just consume more, and that ties into the whole gamification thing. I mean, Facebook is designed to gamify our minds and make us addicted. Instagram as well. A lot of these there's a whole like addiction philosophy that these app developers incorporate.
Interesting. And we fall right into it.
Yeah,
we're the little rat running the maze, and we don't know any better unless like you can you have that perspective and a point of reference that you can get out of.
Yeah, you have to be cognitively aware.
That's so interesting because I'm guilty of that. I'm guilty of being on my phone, and we've even made the effort to, when we go out to dinner, everybody put their phones in one spot. But then I feel that urge to go and check my phone real quick while we're in the middle of dinner instead of like having conversation. And I watch it. I watch that response, and then I'm wondering if anybody else is feeling this too. And then somebody will grab for their phone, and it was like, well, whoever grabs their phone owes us $5, and so we turn it into a game. There's the gamification back.
How about that?
Exactly. And so, but yeah, it is. I can see the addictive functions of that because we're consistently looking for that outlet.
Yeah.
And I didn't realize. I mean, it's good education. It's a good way to see it.
Right.
Yeah, really fascinating stuff. Well, anything else you'd like to bring up? Like, I know this has been a great show. I'd love to continue to talk about this.
Yeah.
I'd love to have you back, and and we'll pick a solid topic. And I just wanted to introduce you, and I thought that you had so much information that it's good to just kind of get to know the doc and welcome you to this area. How long have you been in Texas?
Been in Texas for about a year and a half now.
Wow.
Yeah.
Well, what do you think about this cold front that just came in and it's snowing in San Antonio, which they never get snow?
Yeah.
Kind of crazy.
I could deal with a little bit of cold, and this is fine.
Yeah.
If it's things like Buffalo, New York, or Toronto, Canada's like negative 28 degrees at certain times of the year, that's just too much for me.
Oh man, if that ever happened in Texas, this place would go broke because they closed down with just a little bit of frost on the roads. So yeah, something else. Well, Dr. Safi, thank you so much. I really do, man. I appreciate you coming on board, and this has been a really, really neat visit with you. And if you'd like to get more information on Dr. Safi, tell us that Facebook.
Yeah, facebook.com, and it's Ask Dr. Safi, AskDoctorSafi.
And do you put updates on that site, like from time periodically, like maybe articles, and you share things?
Yeah, so it's mostly just kind of sharing my thoughts, and and I love to engage with people. So especially people that are interested in developing their career in medicine or considering a career in medicine, a variety of healthcare professions, or looking at technology and its application to healthcare. I love just helping people and just engaging with people and interacting. Yeah.
No, that's great. I think it's great to make yourself available like that. And you being such a young player, you have all this knowledge and how technology and computers and combining medicine. It seems like that's exactly where we are right now.
Yeah.
Well, thank you so much for being on the show, Doc. We'll talk to you later.
Yeah. Thanks for having me.
Absolutely.